Firstly, as with many vaccine-preventable diseases, there's a risk of delaying immunization. Infants under the age of 1 year will have often the highest morbidity and account for virtually all of the mortality among whooping cough cases due to under-immunized adults, unfortunately, infecting babies. And to illustrate this with a current story, there just happens to be a small outbreak in Manitoba reported this past week. So that's just saying that they don't occur infrequently. Current political conditions and media coverage over the past year regarding coverage of vaccination, specifically measles outbreaks, has certainly pushed interest in sharing immunizations forward. It is often difficult for parents to keep track of immunizations that are required since the immunization schedule is a bit complex, and therefore a significant population who would choose to be immunized are being missed and therefore under-immunized. Due to coverage rates with what they are, some diseases are even making a comeback. National program goals have been developed to address this issue that are difficult to achieve without accurate immunization records and complete history. Next slide, please. Significant investments have been made in jurisdictional information systems across the country, and these are intended to act as central repositories for that specific jurisdiction's population. Currently, many of these immunization information systems are only storing a fraction of immunization records, typically those recorded by public health resources. And many of the records exist in silos in other point-of-care systems, such as pharmacies and hospitals, as I'm showing in the slide here. However, these immunization information systems do lay the groundwork for the opportunity to use digital health and immunization management by sharing of immunization information to improve patient care. So therefore, the specific opportunity we'll reference today is to provide clinicians, patients, and their family members with access to patients' complete immunization history and allow the sharing of immunization information at healthcare encounters with the jurisdictional immunization information system. Thank you. Over to you, Sophia and Marnie.
Great. Thank you so much, Beverly. So myself, as well as my colleague, Marnie Hochbomer, will talk a little bit about the digital immunization solution that we're planning for Northern Health. Next slide, please. So I wanted to start by telling you a little bit about Northern Health Authority. Northern Health Authority is located in BC, and they serve about 300,000 people spread over a geographic area of 600,000 square meters. That is an area that's more than 50% of the geographical area of BC. Now, the vision for Northern Health is to lead the way in promoting health and providing health services for northern and rural populations. In this health authority, they've confirmed that one of their strategies is to have primary care play a key role, an essential role in providing healthcare services. As such, a number of the integration services are centered around primary care and the primary care home. Given our rural population and the geographic area that we're covering, interoperability plays a key role. So in that, I'm going to now pass the mic over to Marnie, who will talk more about the digital immunization vision for the Health Authority, as well as the work completed to date. Marnie? Marnie, are you muted?
All the lines are unmuted. Marnie, can you hear us?
Perfect. Am I unmuted now?
Yes.
Perfect. I was talking away and no one could hear me. So yes, immunizations in Northern Health are administered in public health and in primary care. Our documentation standards and business processes are closely followed by BC CDC, so we implement their, standards for that type of documentation. In BC, we use Panorama as a point-of-care immunization entry system and a repository. Within Northern Health, we document in both systems. So we have a AIHS, which is our vendor, and the system that we document into for point-of-care is MOIS. So that stands for Medical Office Information System. And what we do with this is enter into both systems. So we enter our immunizations into MOIS and into Panorama as well. 60% of our users in Northern Health use MOIS. Other EMRs in primary care could include QHR Accuro, Osler, IntraHealth, and TELUS. So it's really important that we, look at the interoperability between all of these systems. Next slide, please. So through our collaborative relationship with our vendor, which is called AIHS, which is Applied Information Informatics System, they help us to create standardizations within MOIS to actually implement standardized documentation for immunization, so it will be easier to share with other systems. In 2013, we developed some interoperability use cases for an eventual interface with Panorama. And we're actively participating in a national immunization interoperability working group. And this work is key to identifying what information should flow between the systems. We need the standardized message to be developed to support immunization interoperability in Northern Health and provincially.
Great, thank you so much. So now we'll pass it over to Karen Hay to talk about immunization in Ontario.
Great, thanks so much, everyone. And I'm really happy to be able to follow my colleagues in BC. It's great to have the local public health unit or regional public health unit perspective to start with, because in BC and as in Ontario, that is where much of the vaccine goes into arms. So all of the work that we're talking about here in Ontario really is with the aim of making the jobs easier for the people who deliver immunizations and helping us to more effectively deliver our provincial immunization program. So next slide, please. I'm going to talk about Panorama because it is our provincial immunization repository here in Ontario, as well as in a number of jurisdictions in Canada. And we've had it operational in Ontario for over 1.5 years with the immunization module. And we also have the inventory module live in all health units effectively today, actually. The last of our 36th health unit went live with the inventory module just this morning. So that's a great milestone. Having the integration of the immunization and inventory modules together is sort of like intra-system interoperability. Being able to track immunizations from a vaccine delivery and distribution perspective. Health units, while they don't deliver the bulk of the immunizations in Ontario, they do distribute all of the publicly funded immunizations. So we are well on our way to having a fully interoperable system for immunizations in the province. And Panorama is that first step. So because of the legislative focus in Ontario on school-aged kids, and they are a priority population for immunizations, they were our initial focus with Panorama. We have more than 6 million client records in the system, representing over 83 million immunization records for Ontarians. And a really key benefit is that part of our Panorama implementation, and this is a key part that we could not have accomplished without the support of Canada Health Infoway's interoperability working groups, or was formerly known as the Standards Collaborative Working Group. All of those records are in Panorama in a standardized way. So it was a huge data migration effort from 36 disparate systems, standardizing to the SNOMED CT terminology standards that we developed with Infoway. And I'm going to spend more time talking about the terminology standards that we worked on with Infoway, because it really was a key collaborative effort. They were developed by the SWIG, now the Interoperability Working Group. While the initial focus was to get these standards, this vaccine terminology, defined in such a way that we could use it in Ontario, we went to great pains to ensure that this was not a panorama-specific solution. We really were looking to define vaccine terminology that would work for any vaccine administered in Canada, recorded in any immunization system or electronic health system. So to that end, after we had deployed the standards in Ontario Panorama, we worked with our Health Information Standards Council, and last May these vaccine terminology standards were approved as the standard vaccine terminology for use in all electronic health information systems in Ontario, which is going to be key for some of the interoperability benefits that I'll speak to in a few moments. Before we get to the interoperability benefits, I want to highlight another benefit of the standard terminology that we developed with Infoway, and that's the clinical decision support that we are now able to provide through Panorama's forecasting tool. So the provincial immunization schedule is bloody complex and only getting harder to interpret. There's a lot of new products that get introduced. These products have different minimum dosing intervals. They have different interaction rules. It's quite a complex.
Well, the birth location is in the license.
Oh, someone might not be muted. I might want to mute your line, thanks. So it's quite a complex thing to try to wrap one's head around, and we've heard through a number of forums, most recently through some clinical requirements gathering that Infoway ran for the country, that clinical decision support for provincial immunization schedules is something that clinicians would benefit from. I can certainly speak from the public health unit's perspective here in Ontario. They've told us loud and clear that they love having the clinical decision support of Panorama's forecaster. And again, a key critical success factor for this is having the standardized vaccine terminology so we can identify with great specificity exactly what products a person has received. We can take into account that they might not know exactly what products they've received, and that is going to also impact their immunization schedule. So within the public health domain, we've already recognized the benefits of the forecaster, and we are looking to expand that beyond the public health.
We know for sure it's been scored.
So next slide, please.
Captured in data somewhere.
If we could just pause for a moment and ask people who are on the line to mute themselves, please, as your conversations are coming through and disrupting the session. Thank you.
Thanks, everyone. So I won't spend too much time on this slide, but what I do want to highlight is a story that happened fairly soon after we had implemented Panorama, and really was a beautiful illustration of exactly what a provincial immunization repository is supposed to help support. So we had a number of measles outbreaks this spring, not just in Ontario. I think they happened across the country, but we had one in Niagara region, which is in the southern part of our province, and it was reported. We had, of course, the positive measles test comes into public health at 4:45 p.m. They always come in at the end of the day. And because we had, the health unit was an active user of Panorama, and because it was in a school-aged child, we were able to, public health was able to do something that they would not have been able to do with this expediency or accuracy in the past. And what the public health staff did was they pulled up Panorama. They were able to identify every kid in the measles case school who was not appropriately immunized for measles. Sometimes that meant that we just didn't have all of the measles records on file, but often it meant that the kids were actually unimmunized because their parents were conscientious objectors, for example, or maybe there was medical contraindications. So within moments, it was quite literally a matter of minutes, the public health unit staff were able to pull that list of all the susceptible kids in the school. They gave that list to the principal to say, these kids cannot come to school tomorrow because they are at risk for measles. And then they were able to phone the parents of every single one of those kids to have a conversation with them about the risk for measles, the documented risk for measles in their kids' school, and the benefits of immunization. So what that meant was the health unit was able to halt transmission of measles within the school immediately. There was no secondary transmission within the school. And a secondary benefit is many of the students who were unimmunized because their parents didn't believe in immunization subsequently became immunized, their parents changed their minds in the face of a real and present threat to their kids' health. So we had more kids being immunized. There was no secondary transmission as part of the outbreak support of the investigation, and all of this was enabled by Panorama and by the vaccine terminology and forecasting standards within. So I just find that a really compelling story. It's an example of an early benefit that we're already seeing in the immunization domain. But I want to talk more about where we want to go from here. We recognize in Ontario that the public health domain is the purveyor of the provincial immunization program, but most of the vaccines actually get into arms here in Ontario through primary care or through pharmacies or through other delivery providers. So next slide, please. This is just some of the interoperability goals that we have in mind for immunization records, and it's a bit of a laundry list, but what I want to highlight is that none of these are possible without standards and interoperability conversations that have to happen very early in the development of such systems. So we've already seen the benefits of having increasingly accurate electronic immunization records available to public health. We want to make those immunization records available across the public health or across the healthcare sector. So within the provincial record. I've spoken a bit about immunization validation forecasting. We want to make that available as a service to physicians and other vaccine providers in Ontario. Barcoding, this is something we're working really actively within the Immunization Interoperability Working Group with Infoway on with the vaccine manufacturers to adopt the standards and to link those the vaccine barcoding standards to the terminology standards. So we get away from fingers on keyboards and get increasingly accurate data through scanning of barcodes. Integrating ultimately our physicians' EMR systems and pharmacy systems with the provincial immunization repository. Consumer mobile health applications is a really fascinating one to me, and it might be because of Ontario's rather unique legislative framework whereby the burden for reporting immunizations actually rests on the parents. Physicians don't have a legislative obligation or authority to report the immunizations that they provide to the public health repository. That burden rests with the parents. So it works well in considering the increasingly electronically, technically savvy population we've got, considering the immunization records that people want to keep on their iPhones and other smartphones. We're looking at how we can work within the standards conversations to make sure that these mobile health applications can speak to provincial resources. Vaccine safety surveillance, which is a national endeavor. Obviously, the data comes in from the local level. So knowing more accurately what immunizations are provided means that the AFI investigations will result in better analyses. And then finally, transferring immunization records across jurisdictions. We have a mobile population in Canada, as you know, and having immunization records in the same format means that when a child or adult moves from one jurisdiction to another, it's a much more straightforward endeavor to get the new provincial registry updated. Next slide, please. So the last couple of slides are just for fun. I wanted to show you some of the prototypes that we have mocked up in Ontario, looking to our broader immunization interoperability vision. So this is a functioning prototype. It's not attached to real live data yet. This is all just dummy data. But this is a functioning prototype that we've mocked up that we see it making available as a web service to the public and to physicians for being able to look up your immunization history. I have 2 kids, and I've lost both of their yellow cards, I say with no small measure of shame. So it's we're looking to make this available where we know the information is in the provincial repository. This is something that with proper authentication you could look up for yourself, for your kid, or your physician or clinician could look this up on your behalf. So this is a mock-up that we've made that looks very much like the current paper yellow card, but would be an electronic version. And I want to draw your attention to the QR code at the top. In addition to the barcoding, which I mentioned earlier, we're also doing a great deal of work on QR coding, which is to, again, take fingers away from keyboards and have both the public and clinicians be able to transfer information, demographic information and immunization information in a standardized format through this means. Next slide. This is a number of consumer immunization application prototypes. Again, the ministry in Ontario doesn't want to really be in the application development business, but what we are interested in is having a standard interface from a data perspective to have clinicians who are using their EMRs to record immunization data captured in a way that it can be transferred to the provincial repository so it could access things like the provincial forecasting tool or to make sure that the provincial immunization records are up to date. So these are just some prototypes that we have mocked up. Next slide. I think this is our last one. This is also a functioning prototype. These aren't just wireframes. This is not vaporware. These are things that we have working from a technology perspective, and we are working very hard on the supporting legislative and policy work that we need to have in place in Ontario to make these a feasible part of our provincial electronic health record. So this is a screenshot from some work we did with Connecting Southwest Ontario, specifically Hamilton Health Sciences Hospital, where they used the interoperability specification that we have defined. It's a FHIR-based specification for any techies on the line, to query the provincial immunization repository from the Clinical Connects viewer, the clinical viewer that Hamilton Health Sciences and others in the Connecting Southwest Ontario region used, to query Panorama and come back with the complete immunization record for the client in Panorama. So this is actually fully functioning. It worked incredibly easily. We were a little surprised at how quickly they were able to code this. Once we gave them we call it the Immunization Health Record Specification, the Hamilton Health Sciences coders were able to get the functioning prototype running in less than 2 weeks. So it just goes to show you that the standards and the specification work ahead of time really does help the technology work go much more smoothly down the road. So that's it for me. Tanya, is there time to take questions, or how do you want to do this?
Yeah, I was going to say, first of all, I was going to thank Sophia, Marnie, and Karen for providing this overview. They do have to leave at the top of the hour, so if anyone has any questions for them at this time, there's none on the panel? Okay, we'll just pause for a second if anyone wants to put any questions in.
All the lines on our end are unmuted, so if you've muted your phone individually and you have a question, you take yourself off mute.
Okay, so again, I want to thank Karen and Sophia and Marnie for that, and it's a great setup for we're going to start talking now about what Infoway is doing to help support, and you've heard a little bit from the folks on the phone, what Infoway is doing to work with stakeholders like Karen, Sophia, and Marnie to help move this work forward. So thank you, thanks for your presentations. Okay. So now I'm going to talk a little bit about Canada Health Infoway, some of the work that we're doing to support initiatives like those that you've heard on the phone, and how we're bringing people together to really move the digital health agenda forward. So for those on the phone who don't know a lot about Canada Health Infoway, we were founded in 2006, and really the core focus of all of the work that Infoway has done over the years has been on sharing of clinical information between different points of care. So we heard about public health, pharmacy, EMRs, and really creating that electronic health record for patients that helps to make better clinical decisions, helps, Karen talked a little bit about a story there where they were able to reach out to parents of students and to help better inform them and make sure that they didn't come into school. So the Electronic Health Record Initiative is really all about gathering that clinical information and making better decisions and helping clinicians and others improve patient care across Canada, and Canada Health Infoway has focused on that.
We have done a lot of work, and you've heard some, again, on the phone, helping with our provincial projects or jurisdictional projects to get a lot of that core health information into repositories. Things like dispensed medication information, lab test results, clinical reports, immunization, diagnostic images. But like you heard on the phone there's still a lot of opportunities. So the information may be captured in a repository in a province, but there's a lot of opportunity to get that out into the hands of physicians, into the hands of public health people or others to really improve patient care. And so some of the work that we have recently been doing is around what we were calling the Clinical Interoperability Action Plan. So we have, over the last year, a Clinical Interoperability Steering Committee has published an action plan that talks about how we focus on key priorities across the country, projects that are going on the ground that we can provide some support, some, collaboration, some support to really help to accelerate initiatives across the country. So this Clinical Interoperability Steering Committee published an action plan, and we have been executing against that action plan, bringing together communities to collaborate around some of these key priorities, and I'll talk about what those priorities are, bringing together working groups to work on things like terminology, to work on other, other sort of technical components that really help provinces across the country to move faster and to make more progress on the digital health agenda and to sort of reuse and reuse some of those assets. So the current priority areas, according to the action plan that was published, around medication safety, communicable disease management, and coordination of care. And in particular, we're focusing a lot of effort on what I'll call medication safety at transitions of care. Some of you may know that as medication reconciliation, but there's a lot of challenges that happen when a patient moves from the community into hospital, making sure that the hospital is aware of all the medications that patient is taking, and then when the patient comes out of hospital, making sure that providers and family members in the community are aware, and now that they've been discharged from hospital, what medications they should be taking. So big focus on that medication safety at transitions of care, work going on around e-prescribing as well as immunization, you heard a bit about that, and coordination of care and secure messaging, or coordinating the care between multiple clinicians. And what we have been doing in this past year is really a multi-stakeholder participation in a collaborative process. So we've established communities in those areas. We've established a medication management community where people can talk about e-prescribing or medication safety at transitions of care, or other medication-related sort of digital health opportunities that they're interested in. We have one around public health, and Bev will talk a little bit about that, as well as a coordination of care community. We have been hosting clinical requirement sessions or workshops with clinicians and with other experts in these areas to talk about what is it that they need, what are their priorities, and to talk about what's the information they need or they need to share, and how does that need to work with their workflow to successfully enable them to improve their health through the use of digital health. And then, once we understand what it is that clinicians need, the conversations can move to how do we support that through things like terminology and messaging standards and technical artifacts. And so I'm going to hand it over to Bev, and Bev is going to talk more specifically in each of those areas, using the immunization example, about how we've been able to collaborate and bring people together, some of the clinical engagement we've done, and how we've developed those reusable technical components. But I want you to think about the fact that these are the types of things that we're not just doing in immunization, but we are doing in some of those other areas, like e-prescribing and medication safety at transitions of care. And, those priorities could evolve into other priorities as well, but those have been our key focus areas for this year. So at this time, I'm going to hand it over to Bev to talk more about the immunization example.
Thanks, Tanya. We've covered a lot of the intro to this slide, but I think that, the real gold in our process and approach is really about the clinical engagement and the collaboration that we've been using, and we'll get into some of that. But before we do, I'll certainly review those benefits again and talk a bit at the end about some of the plans for the reusable technical components, as we're calling them. Great. Next slide, please. So the benefits. And a lot of this is sort of rewording, if you will, in some cases, but being more specific in others in some of the areas that that I spoke about at the beginning and that Karen and Sophia and Marnie addressed in their slides as well. So the key thing is by providing this mechanism for stakeholders to work together, come together, and collaborate together and resolve the immunization sharing issues and listen to each other's perspectives and so on, we can develop these common building blocks and realize the benefits sooner. The key benefits that were identified from a survey conducted this year, and there are more. You can provide different flavors of them, but it's really all about reducing missed immunizations, minimizing duplication of immunizations. From our survey, we know that we heard 30% of the parents say their child is likely missing immunizations, and as I said before, likely due to not knowing when to bring their child in for an immunization, and conversely, missing opportunities at the clinician visits. When information is missing or unclear, clinicians will typically immunize again. When in doubt, immunize, and that is contributing to some duplicate immunization. And in our survey, as you can see, we identified roughly 18% who said they had a duplicate immunization. And finally, many of us will recognize the need to have access to our immunization histories to not only allow us as clients to manage our own immunization care, but also to be able to have it handy and ready to provide when we need to. Next slide. So the intent of the clinical engagement process, it's an area to gain an understanding of the clinical workflow patterns and requirements to enable immunization interoperability between pharmacists, physicians, nurses at the point of care, and the jurisdictional information systems. And further, to document it and promote the use of those clinical requirements. So to highlight, some of the results of our first clinical engagement with, as Karen, I think, highlighted, we had folks from across the country who represented frontline clinicians who administer vaccines, as well as some public health folks. And I think, as Karen alluded to, it was really a great opportunity for those folks like Karen, Sophia, and others who may be planning projects in their jurisdictions to hear what these frontline clinicians said for their requirements through the expression of need and the documented requirements that have been made available to folks. So just an example of what we heard. And by the way, there was a lot of what we heard that we assumed and knew, but there was a few really important gems. An example is clinicians said, I do not want to sign into another system to enter immunization data. I want to only use my own point of care system. And that by signing into another system, it requires additional steps in my workflow, takes more time, and doesn't really add value to my workflow. So the key out of that, and they admitted that perhaps phase one, they may have to enter information, outside of their system, as might be a solution in a jurisdiction, but ultimately the signal is for those who are planning in the jurisdictions, they want to have the information in their own system, which requires some different technical components to make that happen. Next slide. Collaboration. This has been a really cool experience here. So first and foremost, in order to facilitate that collaboration, Infoway established, as we've heard already, an immunization interoperability work group. It is led by clinical leaders from BC. And the cool part is that it's been made up of a lot of active people who are coming to the calls and not in small numbers. And more importantly, they're not just coming to the calls, they're actually agreeing to be what I call heavy lifters and actually do some little pieces of work. So we've got vendors, we've got clinicians, jurisdictional representatives. We have folks like the IHI who are on the call, I believe, and we have Public Health Agency of Canada, where, you know, they can contribute to this from, you know, working towards Canadian organizations on those clinical practice guidelines that will now need to align with any interoperability immunization initiative. So there is a real sense of collaboration that's evident by folks on the call, and it's really been cool to experience. And it's spawned other discussions that might not have been part of our scope for this, such as looking at vaccine names that might be appropriate for clinicians and patients, because they are more technical, so trying to do that as well. So I have provided a hyperlink to the work group if anyone who is not on the work group wishes to join in, and I know you'll get the slides after, so you should be able to get it then. Next slide. So some of the key participants collaborating in the work group are stakeholders that you've just heard from, who are actually building, planning solutions today to enable the functionality to share immunization information. So we have this need, obviously, to develop some of those technical components, and we heard Karen refer to terminology and other pieces such as messaging, and some of what I've listed here, like data elements, talking about requirements to share, use cases to share information electronically, how point of care systems will use that information. And so those that are really on the ground in their projects are really happy to take advantage of participation, broad participation and discussion, collaboration, and so on, so that the stuff they are building is more robust and better, but more importantly, can be made available and shared with others in future implementations. So next slide, I think that is it for our webinar. And I would like to thank you for hanging in there for almost 45 minutes and listening in. And I think at this time, we're opening it up for questions. And
does anybody have any questions for Bev? There are no questions. At this time, we'll wrap up. If you think of other questions, feel free to get in touch. It would be the same email that was part of your Join This WebEx reminder. I believe there was a contact information available there. I think it's mine. You can send it to me. Later on this week, we will be sending out some instructions on how you can access the recording once we have it published for viewing. There might be a little bit at the beginning that got cut off as the recording service was being turned on, but otherwise the majority of the presentation is there, I think, minus the first minute or two. The other thing that we'll let you know is in that email you will have a link to the working group that Bev provided, so feel free to join, take a look at InfoCentral and join that group. There's just one more check from the panel, but hearing no other questions right now, I wish you a good afternoon and thank you for joining.